Bismillahirrahmanirrahim. Today we are going to our fourth question of the series of quiz which we are doing in relation to hypertension. And this fourth question will be related to non-pharmacological treatment in hypertension. And I feel that non-pharmacological treatment or conservative measures are very important when you are managing a patient with high blood pressure. And always consider these things because they not only reduce the number of medication, but when you take care of these non-pharmacological measures and your patient is really following them, it reduces morbidity and mortality by taking care of other comorbids as well. So it's very important to advise these non-pharmacological measures. If you look here, today a question is, which of the following is most accurate regarding non-pharmacological management of hypertension? Now again, we have four options. Adult men and women with hypertension should be advised to consume a maximum of 4 standard alcoholic drinks. So it's related to intake of alcohol. Increased dietary sodium is recommended for all adults with hypertension. For weight loss, to reduce blood pressure in patient with hypertension, the reduction must be typically be greater than 10% of the body weight. Most patients with hypertension should be advised to discontinue even modest coffee. Now, out of these four, to me, they are looking the one which is more appropriate. This marked one may not be the appropriate one. You have to pick the right one. So I would like you to think of out of these four. And now I am going to give you the right answer, that which one is the right answer. Here you see. The right answer here is that increased dietary potassium is recommended for all adults with hypertension. And it has been seen that when you're taking an appropriate amount of potassium, it reduces blood pressure. But you have to be very careful in patients with chronic kidney disease, and if they are taking drugs which can really retain potassium. So you have to be checking their potassium regularly to see that with their dietary supplementation which you are advising them may not be causing hyperkalemia. So we discuss all these options by going through the guideline-based non-pharmacological treatment. So I'm going to show you two slides which are there, which are advising exactly what kind of non-pharmacological measure you have to do. Now, in relation to weight loss, here you can see that best goal is ideal body weight, but aim for at least 1 kg reduction in body weight for most adults who are overweight. Expect about 1 mmHg for every 1 kg reduction in body weight. So that means that even if you reduced few, you can say a very little amount of weight, it do give you a benefit. It's not necessary to at least 10 kg reduction. So just make small targets for weight reduction, which do give benefit in hypertension. Then healthy diet, consume a diet rich in fruits, vegetable, whole grains, low fat dairy product with reduced content of saturated and total fat. And that is the benefit here. Reduce intake of dietary sodium. So sodium should be reduced to a level, here it's given, so I'm not going into the details. Enhance intake of dietary potassium. Aim this much amount, preferably by consumption of diet rich in potassium, and that you can consult with a dietitian or a nutritionist to know which kind of diet is appropriate for enhanced increased dietary sodium. Now, this slide is very important regarding physical activity. Aerobic, this much of walk, achieving at least that much of hydrate, and that is the benefit this is given. dynamic resistance as well. So this kind of exercise, this much time, this all. So the details are there which you can read by pausing the video. So I'm not, even isometric resistance exercises, they also give you a benefit. So that means every kind of exercise has its own benefit, and ideally one should be doing all three kinds of dynamic resistance, aerobic and isometric resistance. Now regarding alcohol, although in a true Muslim, this is not an issue, but sometimes people do take alcohol. So men less than 2 drink, women less than 1 drink daily. So that is the amount. So that means you have to moderate them. So I think with that, we have covered a bit of non-pharmacological management of hypertension. But what I would suggest that this 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 quiz will be beneficial for even non-medical professionals as well, to go through all these non-pharmacological measures and try to control your blood pressure and take care of all those things, and keep it a regular feature of your life to take care of these non-pharmacological measures. Thank you very much for your patience listening.